Beyond the MMPI, though, there are other testing instruments that many people use, and some have some support and some do not, as far as I'm concerned. One is the Personality Assessment Inventory by Mori, and it's used a lot in clinical practice. Basically, one of the problems with the Personality Assessment Inventory, and it does have some malingering scales, some response style scales on there, but one of the reasons is that I would recommend against using the PAI is that it identifies too many false positives, and it identifies too many people that are malingering or exaggerating when that is not the case. And I think if you look at the literature, that's generally the conclusion of the literature now with the PAI. One test that has a prominent place in the clinical literature now is the Milan Clinical Multi-Axle Inventory. And the Milan, the MCMI-3, is used a great deal. It has a good deal of popularity. But the literature now, I think, is at a point, the research is at a point where most people would say that you should not use it with clinical populations, and that includes should not use it with forensic populations, and that includes also personal injury cases. And the reasons for that is that it exaggerates psychopathology, so that it identifies people as having more symptoms than what other scales would identify and that interviews identify, so it over-identifies psychopathology. And then also it just is not normed on populations that are similar to most forensic populations, and also personal injury cases as well. So one group of people, Selbaum and Bagby, who have done a lot of research on the Milan, basically say, quote, under no circumstances should practitioners use this measure with forensic populations to determine response styles. So the Milan is not one of those, even though it's very prevalent, it's not one of those that I think we should be using right now.